So it turns out that people with complete ACL tears can actually completely heal. Can you believe that? Yeah, they can. And I think that's pretty awesome. According to the research that I read, that I'm referencing, 56% of individuals spontaneously healed 2 years after they initially completely torn the ACL, and that number goes up to 58% 5 years post the injury. Now, the other fascinating thing about these individuals is that they tend to have better functional outcome on average than those who opted for surgical intervention. Now, before you jump up on the injured knee to celebrate, there is a problem with this though. As of recording this video, we do not know, and we do not know how to figure out who will heal and who will not heal from the ACL, complete ACL tears, and there lies one of the major problems. The other problem is that we do not know yet, as far as I'm aware at least, when to see traces of spontaneous healing on imaging. Because if we know that, then it would be a game changer in terms of timely recommendations for surgery. Despite these problems, I still think that it is essential that we push this information out there, because this knowledge is quite uncommon. And the reason being is that there are still outliers out there that can rely on this information. In April 2021, I had a patient come to me fully functional with a complete ACL tear. He could go through cutting motions, he could run same distances. I don't think his knee swelled up at all during his initial injury. And I had a hard time deciding if he needed to do surgery or not. And at that point, he was adamant that he wanted to do surgery, and I was on the fence about if it was necessary for him at all. But at the end of the day, he opted for the surgery, and he was completely back to doing sports 5 to 6 months later. His ability to heal was phenomenal. I can't help but think that he was one of the individuals that would have been on the higher chance of being able to spontaneously heal. And in his case, I don't think it would have made a difference if he had waited if 2 years was the necessary wait time, if he had waited 2 years to find out if he would spontaneously heal, because he was thoroughly fully functional in the first place. So that's why I think it's still important to have this information pushed out there. Okay, all right, bye-bye.